David Gosar es un psicólogo clínico de Eslovenia que ha trabajado con las publicaciones de CTNB1 más recientes que habéis visto sobre el genotipo-fenotipo. Thank you, David. The floor is yours.
Thank you. Can you hear me well? Yes. Hello, my name is David Gosar. I'm a clinical psychologist coming from Ljubljana, and I'd like to share our experience supporting parents of children with rare diseases. So let's start here. Imagine having a baby. All the wonderful thoughts about it, how you're planning the child's room, how her or his siblings will accept her, all the wonderful times you'll have. And then imagine taking a road less traveled by. Robert Frost put it this way: 2 roads diverge in the wood, and I took the one less traveled by. Now that's the road of parents of children with rare diseases. Their road is the one less traveled by. And there are actually 2 roads they can take, both less traveled by. One is the diagnostic odyssey. Now what is the diagnostic odyssey? It is going from specialist to specialist, from ophthalmologist to neuroendocrinologist to neurologist, and not finding a diagnosis. Research says that about 3 to 5 doctors and specialists need to be seen before a diagnosis of a rare disease is found, often even 10. And that can be very excruciating for parents. They need to tell every detail again and again right from this difficult beginning. And that diagnostic odyssey continues in another way as well. Parents of children with rare diseases take their kids to lots of therapists, speech therapists, physiotherapists, occupational therapists, and that takes time, it takes effort, and it can be a severe burden on the family as well. And finally, they look for answers themselves. Because the specialists focus on their specialty field of medicine, they might not know a rare diagnosis, despite the fact that there are 8,000 diagnoses and 35 million people in the EU have a rare disease. Despite that fact, many doctors do not know that specific disorder. So parents look on the internet, they search for information everywhere they can find, and that can be taxing mentally, emotionally, physically, and economically. There's a second road as well. That can be even steeper and more difficult. That one is called early genetic screening. So what happens there? Right after birth or soon thereafter, parents get information on a diagnosis for their child. A rare genetic disorder they know nothing about. Maybe even the doctor doesn't know that much about it. And the scary part about it is not only do they not know a lot about it, when they start Googling and searching for any answers, they find out that probably there is no cure for it. I mentioned there are 8,000 rare disorders. For only a few hundred is there a cure. So they're faced with the prospect of just waiting. And they ask the doctors, can we do anything? Is there anything to be done? And they say, well, we have symptomatic treatment, as we've heard today. But no, until the symptoms appear, there's not much we can do. And that can be terribly frustrating. And time ticks away. And what do? Well, the first thing they do is they try to learn to love the child. And it can be very difficult to establish an attachment to your child if you're concerned, if you're depressed about the future of your child, if you're yourself very anxious. The first year and the first several years are really important for forming that bond between you and the child, and having that cloud over you can be really difficult. They also start looking for alternative and complementary treatments. So medicine doesn't offer a cure, it doesn't offer any treatment. What do? Let's find something. Now that can often provide hope, but it can also make them vulnerable to exploitation. Some also get involved in research, like all of you here, involved in a project aiming to develop a genetic cure or furthering the development of treatment. Now that can be really useful. It can provide a community to get together, to understand each other. It can also be challenging. It can be frustrating if a cure isn't found. And sometimes hoping for a long time that the cure will be found can also be the cornerstone of misery. Parents may hope for years and years for a solution to be found, seeing their life pass by with no cure in sight. So in both cases, parents end up with a psychologically very challenging environment. It's full of stress. And if I were to describe it, it would be probably death by 1,000 cuts. Why by 1,000 cuts? Stress by itself is not a terrible thing. All of us experience stress. And it's not one terrible thing that puts us down. It's a combination of different stressors all at once. When we're facing, Shakespeare put it, they come not in singles, they come in droves. And yes, they come in droves. Financial difficulties, paying the bills for the extra car for the wheelchair, paying the medication not paid by the health insurance, and so forth. Having a child with a rare disease can also be very isolating. Being afraid to go to the store because of the fear that people look at you in a weird way. That your child might have a seizure in the bank and you'll feel stigmatized and unaccepted by the community. Fearing that your child may have a temper tantrum because she or he has autism in the store and being afraid to go there. That's a terrible stress and it's very isolating. Also understanding that your child will have limitations you did not. He will not or she will not take your path in life. She might not have the ability to meet all her friends like you did. She might not reach all the milestones that other children do. And you're again and again beset by those images when they go to kindergarten, they go to school and so forth. So it's another stress right there again. And all of those stresses coming together can be really tiresome. They can be a huge burden, they can be excruciating, and they can be physically exhausting. When I ask parents how much sleep they get, many say 4 hours, 6 hours. A sex life? What's sex life? So what do you do? What do you do when you're in that position? Well, you heard it on the plane, for those of you who were coming here with a plane. They said if the cabin pressure suddenly drops, first put the mask on your face and then put the mask on the face of your child sitting next to you. So first, you take care of yourself. So if you look at any psychological research, it will say what helps in preventing anxiety and depression and will lift you up out of negative affect is physical exercise. Be it yoga, jogging, lifting weights, whatever you like, this is it. It's one of the most efficient ways to promote mental health and prevent depression, even cure depression. And it's great to get you out of your cycle of negative affect. But the important thing to know about it is you have to force yourself. At first, that might seem counterintuitive. Oh, I don't have time, I'm so tired, it's terrible. No. Once you force yourself, that positive affect will follow. The other thing is, remember your friends. Now, having a child with a rare disease can be very isolating because your friends you had before might not know what the experience is like. They have neurotypical children, they don't get it. But that can be okay if you also have a community of parents like those among you who know what having a child with a rare disease entails. So getting together, taking time to meet them as well as your friends from before, going for a coffee, not necessarily to talk about your child, but just the most basic and trivial stuff. That can really help. Preventing isolation is a key factor when you want to take care of your mental health. Another important way of tackling the issue is what science calls mindfulness. So the ability to enjoy the small moments. You might not be able to control events in general, but you can focus on the details. You have complete control of your attention, or at least most of the time. And that means you can enjoy the beautiful and small moments of life intensely. I meet a lot of parents who talk to me and say, after having my child, I appreciate the little things more. The 5-10 minutes of coffee I have in the morning before everybody wakes up. The gorgeous sunset I saw the last time we went out with a stroller on a walk. So that's an important fact. And when all that fails, don't be afraid to look for mental health support. It's not something to be ashamed of. Most of the other people you know do not have that amount of stress. They do not. So it's not shameful to have a depressive episode, to feel anxious, or have also different difficulties in terms of mental health. We mental health professionals are out there and able to provide support, even if we're not very familiar with the disorder. It gets easier if someone's familiar with rare diseases as well, but it's not a prerequisite. Okay, so you took care of yourself, you're taking care of yourself, you're doing what you need to do for your mental health. What do you do next? You take care of others. You, as parents, are constantly taking care of others. So how do you do it? You take care of the siblings. The siblings of children with rare diseases are a known risk group for more difficulties in terms of mental health. More anxiety, but also more behavioral difficulties. So spend time with them, with individual stuff. I myself like to bake cookies and stuff. So do that together with your child, individually, with your normotypical sibling. Not only as a family as a whole, but time with him or her specifically. Help her or him, the sibling, understand the disease of your child. Research shows that those children who are involved in the treatment of their sibling, who know the disease of their sibling, who are involved in the treatment, usually do fare better in terms of psychological functioning. Many also then go on to choose helping professions as well, being enriched by the experience. And of course, take care of your husband, your lover, your friend, whoever is your partner in life. I like Sade's music, and I think she puts it really well when she writes, you are the lover's rock, the rock that I cling to. You're the one I swim to in a storm like a lover's rock. We can be rocks of love for each other there in the most difficult of times, but that can only happen if we take time to develop that relationship. And one of the most important ways of helping parents that come to our department is also reminding them to find time for their relationship, to take that weekend off, to go to the movies, to go to the concert, to renew their love, because that love will be put to the test with a child who has a rare disease. Now, it's a lot easier if your country or your town has also respite care, where parents of children with rare disease can leave their children with professionals and leave them there for a day or two just to get a weekend away for themselves. Obviously, finding a babysitter for a child with a rare disease is quite rare. So yeah, don't forget the lover's rock, right? And finally, be part of a community, like this community. Maybe you cannot change the destiny of your own child, but you can certainly change the destiny of someone coming after you. Someone experiencing the same turmoils and difficulties you did, but then meeting you who will help them through those difficulties, who will help them understand faster, quicker, and easier. Helping others definitely gives us meaning and gives us hope and puts our experience into a new framework. And I think that's one of the most important abilities to be able to cope with that sort of experience in life, the experience of being a parent of a child with a rare disease. Effie Parks put it well. She was talking at the beginning of the conference. She was talking about meaning making meaning out of that experience. I think that's a uniquely human capability. It's really important. It's the alchemy of putting your experiences together to become a different person, to become a different family. And you can teach parents a lot of things, being psychologically flexible, to be able to accept that things aren't as you planned them out to be, but that's okay. We can manage, we can adapt. Teaching self-compassion, being able to be compassionate toward yourself, that you're a good parent, despite what others might feel or look at you weirdly in the store. If your friend was having the same experience, you'd say, you're doing a good job. It's a tremendous thing you're doing. Finding compassion towards yourselves or reframing your experience. But I think the most important thing is being able to put meaning to your experience. And that can be really facilitated here where you're together with your fellow families who are going through a similar experience. So let me end with this story. A few weeks ago, a mother came to our department with a child with a rare disorder. He has Duchenne's muscular dystrophy. And she said, I usually dread coming to the hospital for our regular checkups every year, but this year I was looking forward to talking to you. I was really like, wow, what a nice compliment. And she was saying that their life, the kid is now about 8, 9 years old. And the life of the family has changed because they're starting to enjoy life more. She said they're starting to sort of feel that his disease is part of their family. They're still hoping maybe there's a cure someday, but they're not betting on it. They're living the life right now. And it's a nice life. It's getting better, she says. And then she says, we were talking with him, the kid with Duchenne's, and his brother, and he said, Mom, I wish I had a superpower. I had a superpower so that I could heal myself. And she said, well, you do have a superpower, but it's not that one. And she didn't tell him what the superpower was, but she told me. And she told me his superpower was helping open the eyes of others and helping them see life in a different way. That was his superpower. So I think Robert Frost put it well when he said, 2 roads diverge in the wood, and I took the one less traveled by. And that has made all the difference. That is the power of meaning making. So thank you very much for your attention, and I'm happy to take any questions.